I've known Dr. Dehaven since 1975. I stepped on to the football field as a freshman and became very familiar with Dr. Dehaven as he was our team orthopedic surgeon. And during that time, became quite intrigued by what his role was and how he engaged with the student athletes. Back in those days, sports medicine was in its infancy. So I became very familiar with Dr. Dehaven over the years, and he became an advisor, a counselor, and the true epitome of a mentor for me during that time frame. As I became very familiar with Dr. Dehaven's clinical acumen and skills when I became a resident at the University of Rochester, it was very clear to me that he was at the cutting edge of trying to figure out what the knee meniscus analog really did in its structure and function, as well as how to preserve it. And he truly was a pioneer in developing not only the assessment of meniscus function clinically, but also in how to treat it, both with partial removal and repair techniques, really pioneering some of the techniques that we still use today. He truly does represent what the definition of a pillar is, and the foundation of his work has continued way beyond his original contributions. We had the Dr. Dehaven and myself and Leo Fusilli and Rob Bronstein have had the longest running foursome in the AOSSM Sports Medicine Society golf tournament that requires a contribution to be given by each member, and that money goes to research. And for years, the four of us played and had an unbelievable amount of faux pas on the golf course, for lack of a better word.
Dr. Dehaven always did what he felt was the right thing for his patients. The patient always came first, even if that meant a procedure that might take longer and reimburse less. He would often meet the athletes that he treated at off hours, if that was what worked for a student athlete. Important as a pillar, Dr. Dehaven inspired residents and fellows to follow the same path of excellence. Many of his former residents and fellows owe a large level of their success to Dr. Dehaven. That is evidenced in those who contributed to this effort. I came to Rochester in awe of his reputation. I will always remember moving into my apartment at the start of my fellowship year, turning around and seeing Ken and Jean Dehaven with some groceries, a road map of Rochester before GPS, and a dinner invitation. This was Ken Dehaven. Ken also became a good friend. The group of us with Ken Dehaven, Wayne Sebastianelli, myself, and Leo Fusilli became the longest running golf foursome at the AOSSM golf tournament. We even won one year. Pretty good for bad golfers.
I was literally astonished and honored to be recognized as an AOA Pillar of the orthopedic profession. I want to thank everyone who supported my nomination, in particular Rob Bronstein, Wayne Sebastianelli, and Mac Everts for their interest and drive to make it happen. Thank you all.